This morning we're learning more about Lake Superior Hospice. I'm with Sue and Jen. Thank you so much for being here. And of course, now Lake Superior Hospice, we competed in the lip sync battle back in March, so we're still proud of that win. A great fundraiser for your organization.
It was a great fundraiser. Yeah. We all had a good time. It's the biggest fundraiser that we have each year.
All right, and so just tell us more this morning about Lake Superior Hospice.
Lake Superior Hospice is Marquette County's only nonprofit hospice. We've been in business since 1979. Our core mission has always been hospice, but we've added some new services in recent years. One of those services is an adult day services program that we added to our agency in October. So we're looking for opportunities to reach our clients earlier in their disease process, or those individuals who are not ready for hospice but need some additional care. And one of those programs that we recently added is called a Transitions Program. And the Transitions Program is for those individuals who are not yet ready for hospice. They're not homebound, they're not eligible for home health care, but they need extra support in their home. So what we do is we provide one nurse visit a month and a number of phone calls that if the clients, the patients have any questions, they can give the nurse a call. We'll check in on them. The program has been traditionally a private pay program, but we're really fortunate right now that we receive funding from the Michigan Health Endowment Fund, excuse me, and we have some grant funding that is able to support that program through November of 2018.
That's great news. And Jen, you recently took over as medical director.
I did. Unfortunately, we transitioned away from having Larry Skensel with our organization. He was a pillar for hospice and palliative care in our community. But the job with Lake Superior Hospice, I do it part-time, I do it as a volunteer, and Larry wanted to make hospice his whole job, and so he's moved to Wisconsin for that. But I've been with Lake Superior Hospice for, I think, about 7 years as an assistant director with Dr. Stuart Johnson. I've also been in the Marquette community since 2005, both my husband and I. I'm a Houghton native. I graduated from Michigan Tech and then went to University of Michigan for medical school. My husband and I came back up here to do the family medicine residency program at Marquette General, and I finished that in 2008. So I've been working as a family physician in our community since then.
And something you say people don't know about hospice is you can do self-referral.
Right, so that was one of the things I wanted to talk about this morning is that, so I guess to just back up, one of my jobs as the medical director is to determine if someone is eligible for hospice care. And I'm looking for a couple things. First, I'm looking for if what they want for their health care is in line with hospice ideals. So we value quality of life and palliation of symptoms over longevity. Incidentally, sometimes the good care that we provide results in longevity, but that's okay. The other thing I'm looking for is that people do have to have a terminal illness or a collection of diseases that is likely to or may result in their death within 6 months. That's kind of a tough call, and so I'm available to talk to physicians in the community to help identify patients in their practice that might qualify. But like you said, people can self-refer. So if you have a loved one or if you yourself are sick and are concerned that you might be one of those people that might be eligible, you can call our agency and we send one of our experienced nurses out to your home for what we call an info share, which is basically we explain what it is that we do and we talk to the patient about their needs and we make sure that our needs are in line. And if our nurse does think that they're eligible, then she talks to me and I talk to their primary physician and we make sure it's a good fit and then we can enroll people.
And Sue, as people look at your website right here, a way to get in contact with you, more contact information is on there, but you cover outside the Marquette area.
Yes, we do. We cover roughly a 40-mile radius. Our offices are here in Marquette, but we serve clients in Ishpeming, Negaunee, Gwinn. We have clients in Republic, Big Bay, Chatham, so we cover a good portion of Marquette County.
Okay. Thank you so much for being here, both of you, and telling us about Lake Superior Hospice this morning.
Thank you for having us.
All right.
Thanks.